Alzheimer's disease stands as a devastating neurodegenerative disorder, progressively eroding the very essence of an individual. It is a condition that relentlessly robs millions of their memory, cognitive abilities, and ultimately, their independence. This disease impacts not only those diagnosed but also their families and caregivers, creating a profound ripple effect across society. Our purpose today is to provide a comprehensive overview of Alzheimer's disease. We will delve into its complex mechanisms, explore its far-reaching consequences, and critically examine current treatment limitations. Crucially, we will also present the compelling rationale behind a new clinical trial, offering a beacon of hope in this challenging landscape. At its core, Alzheimer's disease is characterized by the abnormal buildup of two key proteins within the brain. These proteins, when misfolded or aggregated, disrupt the delicate balance essential for healthy brain function. Their accumulation marks the pathological hallmarks of the disease. The first hallmark involves amyloid plaques, which are dense, insoluble clumps of beta-amyloid protein. These plaques form in the spaces between nerve cells, interfering with cellular communication. They are believed to initiate a cascade of events leading to neuronal dysfunction. The second hallmark consists of neurofibrillary tangles, which are twisted fibers of tau protein. Tau protein normally helps stabilize microtubules, vital structures within neurons. In Alzheimer's, tau becomes hyperphosphorylated and aggregates inside brain cells, disrupting nutrient transport and cellular integrity. Together, these amyloid plaques and neurofibrillary tangles disrupt the intricate communication networks between brain cells. This interference impairs synaptic function, leading to a progressive decline in neuronal activity. Ultimately, this pathological process culminates in widespread brain cell death, particularly in regions critical for memory and cognition. While the exact cause of Alzheimer's remains elusive, several factors are known to increase an individual's risk. Age is undeniably the biggest risk factor, with the likelihood of developing the disease increasing significantly after age 65. As global populations age, the prevalence of Alzheimer's is projected to rise dramatically. Genetics also plays a role, with a family history of Alzheimer's increasing one's susceptibility. Specific genetic mutations, though rare, can cause early-onset forms of the disease. More commonly, certain genetic variants, like the APOE4 allele, increase the risk of late-onset Alzheimer's. Beyond age and genetics, lifestyle factors contribute significantly to risk. Poor diet, characterized by high intake of processed foods and saturated fats, has been linked to increased risk. A sedentary lifestyle, lacking regular physical activity, also appears to be a contributing factor. Furthermore, cardiovascular diseases such as hypertension, high cholesterol, and diabetes are recognized as significant risk modifiers for Alzheimer's. The consequences of Alzheimer's disease are profound and progressive, affecting every aspect of an individual's life. The most prominent symptom is progressive memory loss, initially manifesting as difficulty recalling recent events or new information. This memory impairment steadily worsens, impacting daily functioning. Patients also experience increasing difficulty with language, struggling to find words or follow conversations. This can lead to frustration and social withdrawal. Their ability to communicate effectively diminishes over time, isolating them further. Impaired judgment becomes evident, affecting decision-making and problem-solving skills. Simple tasks that once were routine become insurmountable challenges. This decline impacts personal safety and financial management. Personality changes are also common, with individuals exhibiting increased irritability, anxiety, or apathy. These shifts can be distressing for both the patient and their loved ones. The person they once knew gradually fades. Ultimately, Alzheimer's disease leads to complete dependence on caregivers for all daily activities. Patients lose the ability to feed themselves, dress, or maintain personal hygiene. This final stage represents a complete loss of autonomy and self-sufficiency. While there is currently no guaranteed prevention for Alzheimer's disease, research suggests that certain lifestyle modifications can potentially reduce risk or slow its progression. These strategies focus on promoting overall brain and cardiovascular health. Adopting a healthy diet, such as the Mediterranean diet rich in fruits, vegetables, whole grains, and lean proteins, is often recommended. This dietary pattern is associated with better cognitive outcomes. Regular physical exercise is another crucial component, improving blood flow to the brain and promoting neuronal health. Engaging in cognitive training and mentally stimulating activities can also help build cognitive reserve. Furthermore, effectively managing cardiovascular risk factors like high blood pressure, diabetes, and high cholesterol is vital. These proactive measures offer a glimmer of hope in mitigating the disease's impact. Current treatments for Alzheimer's disease primarily focus on managing symptoms rather than altering the underlying disease pathology. These medications aim to provide temporary relief and improve quality of life for a limited period. They do not stop the progression of the disease itself. Examples of these symptomatic treatments include cholinesterase inhibitors, such as donepezil, rivastigmine, and galantamine. These drugs work by increasing levels of acetylcholine, a neurotransmitter important for memory and learning. Another commonly used medication is memantine, which regulates the activity of glutamate, another neurotransmitter involved in cognitive function. While these treatments can temporarily improve cognitive function in some patients, their effectiveness is limited. They may offer modest benefits for a certain duration, but they do not address the fundamental biological processes driving Alzheimer's. Patients often experience a plateau in benefits, followed by continued decline. Furthermore, these medications are associated with common side effects. Patients may experience nausea, vomiting, diarrhea, or dizziness. These adverse effects can sometimes limit their tolerability and adherence to treatment. The benefits often do not outweigh the discomfort for some individuals. The critical need remains for disease-modifying therapies that can slow or halt the progression of Alzheimer's. Current treatments offer only symptomatic relief, leaving the underlying pathology unchecked. This gap highlights the urgency for innovative research and development. Beyond their limited efficacy, current treatments are also costly, placing a significant financial burden on patients, families, and healthcare systems. The long-term management of Alzheimer's, including medication, caregiving, and facility costs, represents an enormous economic challenge. This financial strain exacerbates the emotional toll of the disease. The burden of Alzheimer's disease is immense and growing globally. Millions worldwide are currently affected, and these numbers are projected to increase dramatically with the aging of the global population. As life expectancies rise, so too does the prevalence of age-related neurodegenerative conditions. This is a global issue, not solely confined to Western societies or specific demographics. Alzheimer's impacts individuals and communities across all continents, transcending cultural and economic boundaries. Its reach is truly universal. The disease has a devastating impact on individuals, stripping them of their identity and independence. It also profoundly affects families, who often bear the primary responsibility for caregiving. The emotional and physical strain on caregivers is immense, leading to high rates of stress, depression, and financial hardship. Alzheimer's leads to significantly increased healthcare costs, encompassing doctor visits, hospitalizations, medications, and long-term care facilities. These expenses strain national healthcare budgets and individual family finances. The economic drain is substantial and escalating. The significant caregiver burden is a defining characteristic of Alzheimer's. Family members often sacrifice their careers, personal lives, and financial stability to provide round-the-clock care. This unpaid labor is invaluable but often goes unrecognized and unsupported. Beyond direct care costs, there is a substantial loss of productivity due to the disease. Individuals with Alzheimer's are unable to contribute to the workforce, and their caregivers often reduce or cease employment. This represents a significant economic loss to society. The staggering economic and emotional toll of Alzheimer's disease underscores the urgent need for effective interventions. The human suffering and financial strain demand a concerted global effort. Finding solutions is not merely a medical imperative but a societal one. In light of the profound challenges posed by Alzheimer's disease and the limitations of existing treatments, we are introducing a new drug candidate for clinical trial. This represents a critical step forward in our ongoing fight against this devastating condition. Our commitment to advancing scientific understanding and developing effective therapies remains unwavering. This drug candidate targets a specific mechanism believed to be central to Alzheimer's pathology. For instance, it may focus on reducing the formation of amyloid plaques, clearing existing tau tangles, or modulating neuroinflammation. By addressing these fundamental processes, we aim to intervene earlier and more effectively. We believe that this novel approach has the potential to slow or even halt the progression of Alzheimer's disease. Unlike current symptomatic treatments, this therapy is designed to modify the disease course itself. This could fundamentally change the trajectory of the illness for patients. Our ultimate goal is to improve the lives of those affected by Alzheimer's disease. We envision a future where individuals retain their memories, cognitive abilities, and independence for longer. This trial represents a tangible effort to bring that vision closer to reality. This clinical trial embodies our unwavering commitment to finding a cure and advancing research in Alzheimer's disease. It is a testament to the dedication of scientists, clinicians, and patients working together. We are hopeful that this endeavor will pave the way for a new era of Alzheimer's treatment.